Yes, well, joining us now, Sandeep Sibal, CEO of the Fourth Frontier board member and also of Give India. Thank you so much for being with us. Now, we've heard about ICRF's involvement in an array of interventions. Tell us why the focus on healthcare.
Yeah, thank you. When COVID first hit, we recognized the fact that the impact it had on the country had multiple dimensions to it. It was, of course, people getting infected, like Dr. Devi Shetty mentioned, and the healthcare aspects. There was also the question around humanitarian crises that were being created with migrants moving from cities to their hometowns and so on, and there were livelihood issues. So we recognized that this was a complex problem, and we decided to focus on many of these areas. But healthcare, we felt, was an area that the leverage was perhaps the greatest. We had the benefit of the fact that the COVID disease had already spread in many other parts of the world. And when we studied cases like, for example, Italy, we realized that it was the failure of the healthcare infrastructure that caused a lot of the complications downstream. And so within healthcare also, we looked at how can we protect our protectors? How can we protect healthcare workers? So we began with that thesis in mind, and we focused on the hotspots. We looked at metros, specifically Mumbai. If you recall, when it began, Mumbai had something like 25% or more of all cases in India. We looked at New Delhi. We looked at Ahmedabad. We looked at Chennai. So we looked at these hotspots, and we said, what is it that we can do to at least firstly protect our healthcare workers? The doctor-patient ratio in India is not the best. So what can we do? And at that time, if you recall, many of the hospitals in Mumbai had to shut down for a period of time because doctors were getting infected. Now, this problem was exacerbated by the fact that there were just not enough PPEs available. So it was a complex problem. We had to supply these PPEs. We had to ensure they were getting to the right places. There was a last mile distribution problem. So we decided that this was an area that we would take on a priority.
जी संदीप जी, मैं आपसे जानना चाहूंगी, जिस तरह से आपने कहा कि आप हॉटस्पॉट्स पे आप लोगों ने तवज्जो दी, दिल्ली में भी और मुंबई का आपने जिक्र किया, तो ये इस वायरस के बारे में बहुत कम जानते थे हम लोग, जिस तरह से अब 8-9 महीने पुराना हो गया है. तो आपकी जो स्ट्रेटजीज थी, आपकी रणनीति थी, किस तरह से बदली कि मदद किस तरह से अलग तरीके से दी जाए?
देखिए, मैं अंग्रेजी में जवाब दूंगा.
बिल्कुल बिल्कुल बिल्कुल.
बुरा मत मानना. The issue of the strategy, and how it evolved is a very difficult one, because I would say there are two aspects to it. One is the fact that the geographical locations have been evolving. So while the disease started in metros, it is being spread now to tier 2 towns and unfortunately to villages as well. So it was a moving target in terms of physical location. At the same time, there's also the problem that it's not just protecting healthcare workers. Upstream from that is the question around how can we reduce the infections by screening, people with symptoms. So we actually went down there and we said, well, for example, in certain parts of Mumbai, difficult to access areas, especially with the monsoons coming on, we went deep into pockets where people were not coming to the hospitals to get themselves tested because it's very difficult to do so. So we had ambulances, mobile medical units that would go into these areas, screen folks, and actually bring back people who had symptoms for further testing, for blood tests and so on. And those who were found to have infections were then treated by the public healthcare infrastructure system. At the same time, we also realized that downstream of this, there were treatment issues. For example, plasma treatment, which you'll hear a lot more about later in the show. The issue was, even though we have in India right now about 1 million folks who recovered from plasma, very few plasma donors. So we try to solve that problem.
Yes, that is a worry. It's amazing, Sandeep Sibal. This is Pranoy here. Thanks very much for joining us tonight. I just wanted to ask you, it's so impressive how you keep changing and analyzing the situation and implement. Can you give us 2 or 3 actual examples of the impact of these interventions that you've done?
I think that's an interesting question. Well, I think in terms of lives saved, it would be difficult to quantify this, but I can tell you that since we begun, we've supplied about 1.5 lakh PPEs to health workers around India, about 250,000 face masks, about 4.5 lakh gowns. And, we've addressed the needs of 50 plus hospitals in these metros. And we've applied more than 100 plus ambulances. So we've done a lot in those terms. In terms of impact, we've also done things that are a little non-standard. During the monsoons, for example, in Mumbai, the train system had shut down, right? The locals were not plying. So we decided to actually have bus and healthcare workers from distant places like Thane down to hospitals like Sion and Nayar, so that, we could actually have a vibrant healthcare infrastructure. So we have done interventions of this kind as well.
Right. Right. No, that's incredible work. And thanks for sharing a lot of those accounts with us.